We have one gentleman in the back, actually, we missed in the first round, and then we'll get to you. You still want to have a moment? Okay, perfect.
Thanks, Angie. My name is Manish Puri, and I'm a doctor trained abroad, actually, in Nepal. So to answer your question, I'm also a young doctor, and I went through the same context that you were saying that the young doctors were in, where there were a lot of local and domestic Nepali students that were there. And they went through the same questions of what to do. Should we go abroad? Should we help out in our country, as it is one of the poorest countries in the world? And that was one thing that led us to get together and talk about, and to see where the ideals were. I'm coming back to the country that I was born, which is here, to help out the people here and the organization, but with the knowledge that I've learned there. And that was the same type of ideality and notions that I got from the students there. They had that sense of pride. They wanted to help their people and stay there. We had students from all around. Of course, we had people from also Kenya. We had from Dubai. We had from Singapore and everything. So they all had their sense of pride that they wanted to help out in the country that they were in. The Nepali students themselves also said to themselves that they're going to help in every which way they can, whether it be politically also, and to engulf themselves in all these different areas. The way to help out for a country like that, or for students that are thinking about where they want to set up their future and whatnot, was basically from the government as well. There were a lot of initiatives which were started in terms of scholarships and maybe a return of services that was there. And that's one of the things that I'm seeing here in Canada as well, as an immigrant doctor trying to get into the system here. For IMGs, International Medical Graduates, there's a return of service in any country or any province that you work here in Canada as well. So if I wanted to practice in Manitoba or northern BC or whatnot, there's a return of service of a few years. And that's rural. And this is what's happening also in Nepal. So these students that were accepted under scholarships and whatnot, they didn't have the option to go abroad and whatnot to get further education. They had to stay in rural aspects, rural points in Nepal for at least 2 years right after graduating. But they were okay with that. They loved the fact that they could do that and engulf themselves in the society alone as medically trained doctors in every aspect, from surgery to deliveries to just family medicine. So I think that's very important for them, and they had that sense of pride with them no matter what. Wherever they did go abroad, they would always come back. There was a handful that wanted to go, but they all had the notion of coming back. And I think collaborating with NGOs, because there's hundreds of them also there that are doing great things in different aspects and different ideals around. So I think that's also very crucial for them, because it's not just about making money, it's about helping everyone. And I think that's one thing that everyone had when they graduated, and that's one thing that they always looked forward to. So I hope to kind of combine with NGOs and also to basically get involved with government with scholarships and whatnot, and that seemed to help. We had about 20 doctors every year that were staying rurally, besides the rest of the graduates.
Thank you for your comment. We'll go over to here and then Shafiq.
Thank you. My name is Wazi, and I'm originally from Swaziland. And I'm also a health professional that was trained abroad, but decided to go back home to Swaziland to work. And my area of work was HIV/AIDS. And I came here, to get married. And had stayed in Swaziland, which I thought I contributed more to my country and to the healthcare there. And I feel that my solution is the countries that are poaching healthcare professionals from poor countries that actually need those healthcare professionals. And these are really highly trained healthcare professionals. Is that those countries should contribute to training of more health professionals and incentives for those healthcare professionals to stay in those countries, in their home countries. And I think the poaching should stop. There has to be ways of saying we've poached enough and it's enough. Stay where you are and we'll support your government in keeping their healthcare professionals. I think it's enough.
Thank you. So Shafiq and then Jay.
I wanted to bring another word into the discussion here, and that's sustainability. In British Columbia, we have 40% of the provincial budget that's being spent on healthcare. That's thousands and thousands of dollars per man, woman, and child per year. And it's not enough. Everybody's complaining. So we don't have sustainability in British Columbia. Many times I've been to Uganda and we discuss sustainability. The healthcare budget in Uganda per capita is $10 per year. So with that, one has to bear that in mind. How are we going to make sustainable healthcare in Uganda at $10 a year per person? And we have to think outside the box. We have to come up with ways that are appropriate and feasible for Ugandan society. And I think that's partly where the challenge lies. You can't have pediatric orthopedic surgeons in Uganda. I mean, you need them, but you can't have them. You can't even get enough orthopedic surgeons, let alone enough doctors. So I bring forward this idea of what can we do to bring sustainability.
Thank you. Jay?
Yeah, I think sustainability is a critical question, and one thing that I liked about Dr. Pirani's initiative was the idea of developing kind of skills and capabilities that were actually capable of being sustained in the area. I think the question about the poaching is a fundamentally important one for countries like Canada that are beneficiaries. And I think we can actually look at some of the themes for tonight as more fruitful ways of solution. We could, for people who stay to work in very difficult situations, having a connectedness with broader communities can help to contribute that. If there's ways that we could actually be looking at contributing to making those work environments more rewarding work environments, that would be a very appropriate way for us to channel contributions. Because in this case, we're actually the beneficiary. And when we actively poach, i.e. when we have recruiting drives to bring people, we're not just letting the tide of the greater privilege that we have in the global north and the global south, we're actually aiding and abetting that movement. There's freedom of movement, there's lots of things, life happens, people relocate, but I think it would be wise, one, for us to look at a direction of funding that could help, but two, to look at the professional interactions that I think speak nicely to what we're talking about tonight, that could actually reinforce people who are staying in their homelands, but with a broader global community. We could really channel positive aspects of globalization.
Thank you, Jerry. So we have actually another portion. So the next question that we'd like to pose, once the clicker works, is on looking at, we've heard these stories with you guys as well, is around looking at diaspora. So how are these stories and these different points that were brought up crossing boundaries, communities, and also disciplines? So we've heard some examples, and we've heard some things that are not as good for society, but how are we actually going beyond our current silos and working with different diaspora, different disciplines, different communities, and how can we look at it in a better lens and move forward on that? So Shafiq was mentioning a little bit on that. Let's have a little bit more dialogue. We've got 5 more minutes before the next speaker to see what we can do in this room with this collective wisdom.
Hi. Put my hand up.
Yes, go.
So,
yes.
My name is Mike Simpson. I'm finding a very rich discussion because my personal practice in doing international work for more than 25 years is around identity structures and getting away from this us versus them problem, and yet it shows up all the time. So just to make it very real, there's a problem in Japan right now, and we see it as their problem. And we identify, I mean, I'm not saying everybody does this, I'm saying I naturally fall into that camp when I hear the problem. And I work in Africa, I work in Peru, I work all over the place, and I often think of myself as going over there to help, or going over there to do something, or helping somebody elsewhere. But the poignant moment that we find ourselves in 2011 is that there are at least 20 problems that require us to think transnationally or globally in nature. And climate change, as you brought up, is a very, very good example of that. Global health, as you brought up, is a fantastic example where we can't maintain our identity structure at a national scale. We have to think globally. And what's cool about this is that although you're going to hear, I mean, one of the things that I did for the longest time was I fell back into that old hippie saying, well, act locally and think globally. And I actually don't think that that works. I think the nature of tonight's discussion is that we need to maintain our local identity structure as Canadians, as Vancouverites, as just my family clan structure, or even just me as an individual. I need to maintain that structure, but transcend and include it to the point that I can actually also identify as a world thinker or a world-centric person thinking about the global problems that we face. And my personal practice is to do this in light of things like Japan and realize this isn't Japan's problem right now. This is a global problem. It's an intergenerational problem. It's an interspecies problem. And when I can identify with that identity structure, I fall into a whole new terrain. And for me, this is difficult stuff because it's natural for us to just fall into our camp and think of ourselves as Latvians or Ugandans or Africans or whatever we want. But the nature of the game that we face right now in 2011 is that we're not going to be able to do that. And I don't see that as a problem. I see that as our biggest, most beautiful opportunity that we can in terms of the evolution of our species. So a very, very rich discussion tonight, and I got dragged into it without even knowing what it was about, and I'm super happy to be here. Thank you.
Thanks, Michael, for the challenge. Any points on that yet, Marge?
Well, one of the major accomplishments our team has done in the last few years is that our project management committee has provided Ghana with Ghanaian team contributions, project master plan and program for the hospital sites for the University of Ghana College of Health Sciences, as well as the Korle-Bu Teaching Hospital, a new center. And this has translated into them asking us, the Ghanaian government, to continue to do so for some other hospitals and come up with a master plan and program for the various sites instead of just hodgepodge. We're going to build on this spot and that spot. How did we achieve that? I mean, it's been a wonderful opportunity to become blended. Like you were saying, Japan's over there. But in our regard, Ghana isn't over there. I'm living and breathing it every day. How come? Because of Skype. Because of communication on the internet. And one of our biggest breakthroughs was every Tuesday morning at 8 a.m., Don Jenyon, our project manager, would get on Skype, as would the provost of the University College of Health Sciences, as would the CEO of the hospital, as would the chairman of the board, as would our members, John and Jocelyn and different ones. Then we would all come together with the architects, the designers, the health planners, and discuss the agenda for the day and what had we accomplished over the week and where were we going for next Tuesday, what needed to be done. And by the time a couple of years have passed, my goodness, we are one family. I mean, we know who's having kids and whose daughter's getting married. It's become a real close unity family. And so that is one sidearm, I would say, is critical, is we need to start talking and communicating on Skype on these different avenues where they get to know us every single day and we're sending off emails back and forth and things are getting accomplished. It's a vibrant community that we're a part of, and we're delighted and they're delighted, and they've fully embraced what we've offered them and we've fully embraced what they're offering us, and it really has become a really terrific life changer for us all. Yeah.
Thank you, Marge.
Thank you very much. I would like to present one of the points that I really feel that is very important to all of us is policy. I disagree a little bit on some of the professionals who have talked about why doctors run away. You cannot just come and convince a doctor in Uganda to stay where he's working when he has taken 6 months without salary. You realize some soldiers are getting paid better than doctors. So when it comes to policy, for example, I'll give you just a key example. The U.S. government is giving a lot of money to our country, more money to fight in Somalia than to aid health care. So it comes to policy. I guess in such a forum, we would need somebody, a very important bureaucrat from Ottawa, maybe from CEDA. When it comes to funding, that's why I was saying that we need to focus on the private enterprise. For example, I know one key program in Uganda, the Uganda Virus Research Center, which is in charge of Rakai Project. I guess if you go on the internet and you Google Rakai Project, you find that's where the first research has taken place that circumcision actually reduces HIV. I know this program employs the best of all the doctors in Uganda, and I don't know any of their doctors that has moved out of the country. Why? Because when it comes to the Johns Hopkins University, the Columbia University, they give their funding a priority and they put this money in the private enterprise. This can help us to bypass the corruption, the political kind of bureaucracy in our countries in order to help the people. In my experience, I've worked with the Lutheran World Federation in East Africa and the whole of East Africa, and I realized that when money comes in the private enterprises, actually you are able to reach more people. For example, these countries may not be necessarily purely democratic, they may not be open, but they have open hands that if you come with help, they will welcome you. So if you come and say you're going to work in the hospital, as long as they are not going to pay you salary, they will welcome you. So what I'm saying, all of us in the diaspora, why don't we engage these benefactors to put money in the private enterprises in order to reach the grassroots? Thank you very much.
Thank you. Chiffy.
I have a slight concern with private enterprise, or for that matter, NGOs, and that's that it's the issue of sustainability. What happens when the NGO gets tired? What happens when the private enterprise decides to go somewhere else? The problem doesn't go away. So this issue of sustainability, I think, is critical. It has to be thought out ahead of time. What's the plan? When you're finished, next 2 years, 3 years, 4 years, 5 years down the line, who's going to take over? And can the thing run without us?
We'll take 2 more, and then we'll move to the next session. Miraj?
Hi, my name is Miraj. I can say that I'm from the Bangladeshi diaspora, but I'm actually going to first touch on the issue about Japan. I think a couple of speakers already talked about that. So me and my neighbor here were discussing during our brainstorming session, say for example, the current earthquake and the tsunami, what happened in Japan. So if you look at it from a health as not as only a physical example, but also we have a very big, large Japanese diaspora right here in BC, one of the largest, I think. So what happens in Japan actually affects mentally and emotionally and puts a lot of stress on the community here. So that's one issue that affects them. And another point is the current nuclear situation. So if hopefully not, but God forbid, if it becomes worsens, and then it might become an international issue. So yeah, the radioactive cloud can travel in any places, right? So then it becomes even a physical issue. So in terms of emergency preparedness and everything and affecting health in any community, it can affect a local event in Japan can affect. So that's what I'm saying, global health is not only interconnected, but it's also an urgent and emergent issue. And in terms of the question right there, so for example, the Japanese diaspora can be a good resource for resiliency and sharing their experience and everything regarding earthquake preparedness or tsunami preparedness, maybe even the Indonesian community. I'm just saying that we may tap into, because we as British Columbians may not be as prepared as we may think. So that's one point I wanted to make. And very quickly, I just wanted to, okay, let's just put it. But very quickly, with the Marge's Rotel's point about, I wanted to maybe question one thing, with all due respect, I mean, there are few issues during international cooperation or international development, like food aid or health issues or like emergency medicine. So why should we only focus on like democratic institutions or government? I mean, diseases or pandemics doesn't discriminate against democracy versus non-democracy, right? So why that issue should come forward, at least in health and food or something like that? Thank you.